Hello, friends, and welcome to another episode of the Concussion Nerds podcast. Today, we're going to literally skim the surface of what happens and what can happen to hormones in men after concussion. We did this episode for female hormones a few weeks ago, and so only fair because it affects men as well. We want to make sure we're getting all that information out there as best we can. Full disclosure, like I said on the female hormone podcast, this is not my area of expertise. I went to the studies to see what I could find to share with you about how hormones are affected after concussion. This is 100% an area that I always refer out for because it's just not within my scope of practice or my knowledge base. But the knowledge base that I have in this area is what I'm going to share with you on this podcast. And it's what I have found in the studies, which, full disclosure, there's not a lot, right? This is an area that, in terms of concussion and MTBI, should be looked at a little bit more closely. This is absolutely something that is not kind of researched a ton that I was able to find anyways, but I am going to share with you what I found today. And then I also always say that if this is something that you're listening to some of these things, or I'm going to share some examples of what symptoms are that can be linked with some of these hormones as well. But if you're someone that thinks this might be something I want to get checked out, then the people that I always kind of pull into my world and refer to for this are those who practice either functional medicine or naturopathic care. That tends to be the route that I go. And again, I shared this on the female hormone podcast too. My reason for that is because they will do the testing to look at the nuances and the relationships between the different types of hormones and all these different elements versus most general practitioners. If you go and request that your hormones get tested, A, it's a question of will they do it? And B, they look at the black and white, right? And that black and white normal range is huge. And so you really do want someone to help you explore the nuances and the pieces that are more uniquely you and the more holistic approach of the other things that could be impacting your hormone levels as well. And we'll talk about that in a minute when we get to kind of some of these pieces. So, like I said, I could find a few studies, but I didn't find a ton. And this is one of those areas that if you really do want to dig in deeper and get some more information, connecting with someone who this is their scope of practice would be highly recommended. What the studies did find and have shown is that, yes, absolutely, hormones can be affected in men after concussion as well. When you start searching male hormones after concussion or how are men's hormones affected after concussion, really what the studies start to bring up is they start to look at growth hormone, which we also know are in women, but growth hormone and testosterone are the two main kind of hormones that seem to come up when you search male hormones after concussion. Again, big answer, both of these hormones can be impacted after a concussive incident. And so this one study looked at, it's an old one, guys, 2009. But anyways, what they found was that pituitary dysfunction, including growth hormone deficiency, can affect men after sport-related concussion. And particularly, they said that this pituitary dysfunction occurs in 15 to 46% of people, men, following concussion. 15 to 46% of individuals after concussion. They said the growth hormone is absolutely the most common deficient hormone that they see. And that these hormone deficiencies can actually occur in the acute phase of concussion, but they can improve over time or new deficiencies may develop. So what does this mean for us? Is this something that we need to be investigating right away? I don't know, right? When we look at the profiles of concussion and we look at the phenotypes of concussion, they haven't opened up to embrace this side of things. Right? Again, there's not a huge amount of research around it. But if we are aware of signs and symptoms, or is there a way for us to screen this at, say, the 3-month mark, that would probably be beneficial. Because if this is going to impact how we can function in certain ways in life, is that something we explore? Also, it's are some of these responses because of other factors? So there's lots of still questions around this area, but knowing that it can affect 15 to 46% of individuals, it just kind of puts it on our radar. And again, that was saying pituitary dysfunction as a whole after concussion can affect 15 to 46% of people, and that growth hormone was the most commonly deficient one. There was another study in 2015 that basically, again, summarized that same statement. They said that growth hormone and pituitary hormone alterations after TBI exist, and that growth hormone is commonly affected post TBI and can lead to, again, if it does not resolve, hypopituitarism. So it is showing up in the studies. So when we're looking at growth hormone in particular, let's chat about what some of those adult onset, so I'm speaking to adults in this one, onset signs and symptoms are, because you can have growth hormone deficiency as a child, right? It's going to look different. It's going to actually affect how children grow and their appearance in these pieces. But an adult onset of a growth hormone deficiency from a traumatic incident is going to be different, right? When we're looking more at an adult onset of growth hormone deficiency, some of these symptoms may include reduced sense of well-being, anxiety and depression, decreased energy levels, increased body fat, especially around the abdominal region, decreased muscle tone, decreased bone density, which will then put you at a higher risk of developing osteoporosis, insulin resistance, which can lead to type 2 diabetes, so things with our glucose and sugar management, increased LDL cholesterol and triglyceride levels, which will then put you at increased risk of heart disease, right? So the problem, though, when you look at it, is those symptoms are pretty general, right? And those symptoms can also, almost all of them, come from all of the other things we treat with concussion as well, right? Decreased muscle tone. For so many people after concussion, they're not able to exercise the way they did or should. So you're going to decrease muscle tone, right? It changes your body compositions, all these different pieces. So again, recognizing too that perhaps if you're doing all the things, right, and you're getting gains in all the other areas and you're still experiencing some of these symptoms, perhaps it's something to look into. Again, we're going to have a guest come on down the road who is definitely hormones is their thing. I'm sure they'll give us better answers, but that is that element of growth hormone. Now, the other hormone that tends to be affected in men after concussion is testosterone. And so there was a study that looked at the association of concussion symptoms with testosterone levels and erectile dysfunction in former professional US football players. Okay. So one summary of the study was that with multiple concussions, the individuals were more likely to report low testosterone levels and erectile dysfunction. And then again, there's thought that the mechanism is related to this hypopituitarism secondary to potential ischemic injury or potential axonal damage, just based on where the pituitary gland sits in our lovely skull. So this study was conducted actually over a period of 2 years out of Boston. And they had 3,400 people that were part of this study that they used. And they found that there was a prevalence of indicators of low testosterone or erectile dysfunction in 18 to 22% of people. So different hormone, different numbers from the previous study we talked about. This was termed, again, because this was looking at the possible testosterone due to hypopituitarism, is now they've termed this post-traumatic hypopituitarism, right? It's the change in the function of the pituitary gland is caused by a traumatic event. And so there is the term post-traumatic hypopituitarism. And so this study, again, looking at over 3,000 people, found that individuals were at higher risk if they had multiple concussive incidences to have testosterone and erectile dysfunction. And that, but overall, that there was prevalence of about 18 to 22% of individuals that fell into this category. What they found and what they shared in their study is that in a large previous study that had looked at erectile dysfunction after TBI, they found that in those with history of TBI and concussion, there was an increase of 2.5 times the presence of erectile dysfunction compared to participants without an injury. So if I were to say that in a different way, if someone had experienced a TBI or an MTBI or concussion, they had a 2.5 times a higher chance of experiencing erectile dysfunction than someone who had not had a concussion. So again, it's just to highlight, this episode is going to be really short because literally those were the 3 studies that I found. But it's just to highlight that yes, post TBI, post concussion, your testosterone levels 100% can be affected. Your growth hormone levels 100% can be affected. When we're looking at testosterone, what are some of the symptoms that can appear with low testosterone? Reduced sex drive, erectile dysfunction, which is clearly why some of these studies have studied erectile dysfunction, loss of armpit and pubic hair, shrinking of testicles, hot flashes, lower zero sperm count, which could lead to male infertility. Other symptoms include depression, difficulties with concentration and memory, increased body fat, decrease in muscle strength and mass, and decreased endurance. So again, some of these symptoms could be explained by other factors. Some of them could be explained just by how you feel as a whole. But if things are improving and these other factors are persisting in your life, maybe it's worth looking at. When I said before, we want to also look at, does this mean you jump to something like hormone replacement therapy? No, it doesn't. Because you also, again, if we're going to have that holistic look, we might look at what else could be contributing to low testosterone levels. Example, having obstructive sleep apnea is a factor that can contribute to someone having low testosterone levels. We know that after concussion, up to 70% of people have struggled with sleep. So would it make sense if you're someone who's having erectile dysfunction or having low sex drive or all these other factors, but you also are not sleeping well, to potentially start with a sleep test to see if that is a factor that could be contributing to the low testosterone levels? Right? This is when having that lens of somebody who can look at the whole picture of who you are and everything that you're kind of going through and moving through to find the pieces that are correlated together. Correlation doesn't mean causation, right? So for poor sleep doesn't mean that's why you have low testosterone. But if there's these correlated things and we know that they can in instances influence, it's worth exploring. So if you're someone that has sleep apnea, for example, there's a possibility you may also have low testosterone, but let's see if we can help the sleep apnea and improve your sleep, because then improving your sleep is also going to improve your well-being. It's also going to improve your memory and cognition, and domino effect, it may help with the testosterone aspect as well. Again, not my area of expertise. This podcast is super short and sweet because that, my friends, is literally the summary of what I was able to find in my I Will Bite short search for articles looking at male hormones after concussion. Now, there are absolutely case studies out there that talk about individuals taking growth hormone that have been successful and testosterone replacement hormone that have been successful. I was, for this episode, very kind of specifically searching for some larger studies to share with you. Now, way back when, I did an interview with TJ, who is one of the owners of Bubs Naturals, which is a collagen company. And I'm literally scrolling through my Instagram right now trying to find this video. So we did an Instagram live together. This was a couple years ago now. And he shared his experience because he'd had multiple concussions, and low testosterone was 100% a huge piece of what he was dealing with. And so on our Instagram live together, he shares his story of what he was experiencing when he had his concussion, how it was impacting his life. And then he shares about getting tested for testosterone. And then he started testosterone replacement therapy, if I remember correctly. But I will reshare that episode or that Instagram live on my stories once this episode drops, because it's just a nice perspective to hear. You know, it's someone who has been through it, is someone whose hormones absolutely 100% were a piece of his healing and recovery puzzle. And I feel like it's always incredibly powerful to hear stories from people who have gone through it and come out insanely successful on the other side, right? And people who have gone through this journey and experienced the things. So I am going to search for it after this podcast goes live. And if I can find it, I will reshare it for sure so that you can listen to it too. And if not, maybe I'll ask him to come back on and chat another time. All right, my friends, I hope you have had a wonderful day. I'm wishing you an amazing rest of your week, and we will talk to you next Monday. Take care. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.